Ipsos polling exclusively for Global News shows 75% of Canadians would support shutting down non-essential businesses in a second wave. 76% also believe a second wave will inevitably hit their community. The majority of us, 71%, believe their province is prepared, but residents in certain provinces are less sure, including 42% of those in Saskatchewan and Manitoba, followed by 33% in Alberta, 30% in Ontario, 29% in Quebec, 25% in British Columbia, and 16% in Atlantic Canada. Overall, 64% of us are concerned about becoming ill with COVID-19. 38% of us believe the speed at which schools are opening in their province is too fast, and just 9% think it hasn't happened fast enough. Canadians' attitudes are firm on some issues. 65% of us saying the ongoing closure of the Canada-US border should continue, and 78% of Canadians support ongoing isolation requirements.
We asked people whether or not they expected a second wave, which is something that's been coming out through our public health officials and through our other public agencies that they should be expecting. 75% of us expect that there's going to be a second wave. And interestingly enough, it's the identical number that says that if there is a second wave, we should really contemplate doing a general shutdown again. People went through the last shutdown, and now they're seeing us going through another rise in cases, and they're wondering, maybe a few people, whether or not it's going to be effective. But also, I think that there's probably some support out there for more specific types of shutdowns. So I think people who have more of a really well-developed sense of what's going on are suggesting that there's maybe, through their answers, there's more specific ways of dealing with this. But 75% support for anything on a poll these days is really hard to obtain, and that's basically what we're seeing right now for support for generally shutting down things if it's required again. Yeah, it tends to go along generally with people's overall feelings about government. So if you're generally have a good feeling about your government, like in a place like Ontario right now, where it wasn't so much general support, I would say, is that Doug Ford's specific performance that's really raised the confidence that people have in the Ontario government's ability to deal with it. Whereas in other places where some of the premiers are a bit more controversial, I would say, in general, you see that confidence is a bit lower. But there's nobody in the entire country at the provincial level that really has less than a majority saying that they're confident in their government's ability to manage the crisis. 63% of Canadians say that they support mandatory vaccination, and there's two parts to that, I would say. One of it is mandatory anything is sometimes a hard sell with the public. They like to have some choice and they like to have a decision made about that. But also on the vaccination itself, given the lack of information about what the risks are, how frequently they'll have to be taken, how likely they will be to come in our lives, and whether or not they'll solve the problems, are all questions that people want to have answered. So to get that number higher, people who are advocating for vaccination really have to answer the questions that I just enumerated. Whether or not, how it's going to work, when it's going to be available, what the risks are. The public has to have some experience with it before they'll be able to buy in at higher numbers than that, I would say. One would think that age would be one of the big discriminators on this, given how much it's shown to be a real serious potential for fatality risk among older people. But no, it tends to be women who are disproportionately concerned about it. But it shouldn't be a surprise. I mean, everything that we ever do surveys on related to health, men feel that they're less at risk for most things, which is one of the reasons probably that men starting at the age of, fairly young ages tend to die more frequently than women, is they tend to pay less attention to their health, they tend to be less concerned about things that are risky, and they tend to participate in more risky behaviors across the board. So that's why when you take a look at the World Health Organization's data on this, of the top 20 reasons that anybody can die prematurely, 16 of them are more frequent among men.